Hope Starkman, and today we're going to be injecting and aspirating possibly a large joint, the knee. We have our patient lie down on the table in a comfortable position. Are you comfortable like that? Can you come back a little bit more? Okay, so we have everything that we need for our setup on this table over here. Everything we need for our setup right at our hands. So we're going to go ahead and clean off the knee, the injection site 3 times, starting in the middle with betadine and going outside the area.
Let that stuff give time enough to work on the knee before you go sticking it through.
Of course. Okay, so we're going to clean off a second time with betadine. And then a third sweep.
Put the painkiller on there too. Let it stand for a minute.
Okay. We're going to spray the site with some topical ethyl chloride to numb the skin. This does not numb the inside of the knee, so there's still some discomfort. We're going to see if this joint has any fluid in it by using a larger gauge, 20 gauge needle, and entering the knee at the upper inner component underneath the patella where we might be able to find fluid. So draw back on the syringe, and yes, there is some fluid in there. So we're going to remove as much of the fluid as possible. And today we're not injecting steroids. Today we're actually injecting Euflexa, which is a series of 3 injections that we use to lubricate the knee and help the knee make its own fluid.
That's coming out.
The fluid coming out of this knee is clear yellow fluid, which suggests that it's probably not inflamed fluid but more degenerative. And if you see, you can actually read through the syringe. You can see the numbers and the markings, which tells you that it's probably not inflamed fluid, and we know that. She has degenerative arthritis. We'll remove the syringe, place it on a sterile surface, and now we're ready to inject our Euflexa today, but we can be injecting any other visco-supplementation agent like Hyalgan, Synvisc, Orthovisc. This happens to be Euflexa.